Good morning, everyone. I'm Seba Aljomaa, and this is my PhD thesis focusing on novel digital health approaches in oncology. Actually, we started our work, like a lot of researchers, to improve the quality of life for cancer patients. And by finding the best digital health interventions for them, we would be achieving our mission. And for this purpose, we are working on two projects in parallel. And let me please introduce my first project, comparing the effect of digital health interventions on the quality of life of individuals facing cancer by conducting systematic review and meta-analysis. Actually, the impact of cancer on patients' quality of life is very clear, especially when we are looking at these percentages of anxiety, pain, and fatigue prevalence among cancer patients. Till now, current standards of care not enough for reducing the suffering of the patients. So, if we are thinking out of the box, looking at the technology where it is widespread among adolescents and everywhere, actually. And on the other hand, we have, during COVID pandemic, we noticed the using of digital health in medical care. Even the WHO started to publish a recommendation on how to use digital interventions in healthcare, so it's expected to improve the quality of life of patients. So our aim is to investigate the efficacy of digital health interventions in oncological care. Actually, we asked the following question. Does the electronic health and mobile health interventions change the mental and physical health outcomes of cancer patients during their therapy as our population? We're going to compare digital health interventions, whatever it is, if they're e-health or m-health interventions, to conventional interventions. The outcomes are mental and physical health outcomes like pain and anxiety, fear, quality of life, and etc. by using the standardized scales. And our hypothesis that digital health interventions will improve the mental and physical health outcomes of cancer patients. For that, we conducted systematic search by using search key of 3 domains, and we started with a pool of about 25,000 articles, ended up with 203 eligible ones. And now we are on the level of data extraction, data analysis in parallel with the risk of bias as well, because we have 4 main categories: mobile applications, web-based interventions, games or exergaming, and virtual reality interventions. And actually, we have finalized the 2 main categories, so today I will start presenting the plots of them. First of all, the first plot is about quality of life change differences between the experimental intervention groups and control groups in 3 studies, using the standardized mean difference because it's the suitable tool in such heterogeneous methodologies. And actually, we have the result of 0.69, which is in the moderate range of standardized mean difference. Since this result is not yet significant, but I would say that looking at the comparison between the intervention and the control, while the result is favoring the intervention, but that it could improve the quality of life of cancer patients more than the controls, we are looking for more research to support our hypothesis. While looking at the fatigue score change after gaming within the intervention groups, without the controls, because it's very heterogeneous, we also use the standardized mean difference of 0.72, which is also in the moderate range, but close to be high, and this result is significant, supporting our hypothesis that by using gaming, we could reduce the fatigue among cancer patients. And now I will talk about the anxiety change differences between virtual reality intervention groups and control groups. While here we used subset of studies because we have different therapies. So we have painful procedures, pricking, we have chemotherapy, radiotherapy, and other type of treatments. Actually, we used also the standardized mean difference to compare between the change in intervention and control groups. And you could say that the results are negative, favoring the effect of the virtual reality in reducing the anxiety, even that these results are not yet significant. And if you notice also the heterogeneity results, it's very high, and it's fair enough because the methodologies used in the studies are very different, and also the purpose of using the virtual reality in each way is to distract the patient, to reduce the anxiety of the procedure, whatever, or the treatment, whatever it is, but actually still the framework of the studies is different. So the strength in our study that several high-quality reports we have, like RCTs, also several measurement tools developed in this field. But we have interviews and semi-interviews, like qualitative assessment, and also we have difficulties in comparison because of this heterogeneity in methodology, mostly small sample size in the studies, so these are our limitations. But we are still looking to more implication on different levels, and I would conclude with gaming intervention improves cancer patients' quality of life, and VR intervention has the potential to reduce the anxiety among cancer patients. So for implication on the level of practice, we are looking to age-specific gaming and VR interventions to start used in the oncological care, and also we are looking for the research level that we need more RCTs with homogeneous populations, and also we need like homogeneous methodologies, a new age, and also specific or disease-targeted gaming and virtual reality to be developed. Now I will introduce my second project that we are working on it also in parallel, which is investigating the destructive effect of tablets, virtual reality, and analgesic cream during regular pricking of childhood cancer patients by conducting an RCT. Actually, the children with cancer are suffering because they should have pricking at least once a week for different purposes during their active treatment. And this procedure causes pain, fear, and distress in children. Unfortunately, until now, we have procedures or we have strategies to reduce that, but it's gonna take time, like analgesic creams, or maybe we have limited sources like technology, procedures, iPad, virtual reality, whatever. Still, virtual reality glasses are a novel, immersive technology with the capacity to distract the patient focus away from the pain. So we aim to define the most effective distracting technique to reduce pain, fear, and anxiety, whatever the outcomes in childhood cancer patients during regular pricking. We ask the question, which is the most effective distracting method in reducing pain and anxiety of childhood cancer patients during regular pricking? We're gonna compare the effect of tablets to virtual reality glasses, and our control is current standard of care in the clinic, which is using the lidocaine and pyrrolocaine local cream. And actually, we're gonna use we're gonna assess the pain outcome by using the FACES scale. We're gonna also assess the anxiety by MASC-10 scale, and satisfaction by 4 Likert scale. And actually, these scales are translated and into Hungarian and adapted. So our hypothesis that the use of the virtual glasses is the most effective in reducing pain and anxiety in childhood cancer patients undergoing pricking. We are looking for the clinical implication of such technologies on the level of clinicians and also for convincing policymakers. Now we are working on this project, and actually now we are finalizing the sample size calculation. And all in all, we are working on 2 projects to improve the quality of life of cancer patients. We are looking for this, and hopefully we're gonna get some promising results. Thanks for your attention, and let me finish my speech today with Albert Einstein. Be a loner that gives you time to wonder, to search for truth, have holy curiosity, make your life worth living. Thank you.
Thank you very much for this nice presentation. And may I ask first the audience if there is any question? Email. Thank you.
Congratulations on your presentation and on your result. Can you tell us what are exactly the EXER games and whether they are available in the Hungarian healthcare system?
Thank you so much for your question. Actually, because the shortness of time, we couldn't explain each technique, but EXER gaming is like abbreviation of exercise and games. So we are using gaming to encourage the patients in general to exercise more. And actually for the cancer patients, there are special or specific games for this purpose. In Hungary till now, I don't think that gaming is start to be in the medical care, maybe still under some trials, I don't know about, but actually the virtual reality is more available in the clinic, and now we are working on looking for using it in clinical care.
Any other question? Katalin.
I see that your population was quite heterogeneous regarding, and the studies included children and adults as well, but looking into the data, could you see any difference between adults and children? Does it work better in children?
Thank you for your question. Actually, yes, the data, the population is very heterogeneous regarding age and cancer type, which is in some studies is not the main purpose, whatever it is. And the difference actually, first of all, in scales, because children have their own scales regarding pain and anxiety, whatever to be assessed, which is a challenge for researchers to find at some point. Secondly, maybe the children could be more into gaming and virtual reality distraction, because it's, I would say, could be easier to distract them at some point. They're more into, but still also the adults show that they are interested in such interventions. But I think mostly this is the difference. We didn't find a lot of differences other than maybe better results for the children. At some cases, not all.
Congratulations. Maybe my question is coming from an outsider. So how much psychological support, therapy, like psychological therapy support would be available? And is it possible to compare the effects of the one and the effects of the other?
Thank you.
The digital methods that are really exciting.
Okay, thank you for your question. Actually, we were in this discussion last week about if we are able to compare different interventions together. And actually, it's a very challenging step, because we need all the conditions to be the same. Because, okay, we could compare different things, but the framework for the intervention is the same. Like, not by comparing a game to a virtual reality video, it's gonna be so different. So we need similar conditions, and we are still analyzing, so we are not sure that we have enough data for that, but we're gonna see for that in the future. Regarding the first question about the psychology support, actually in the studies, they are looking for the patients that they are anxious, but they don't have an anxiety disorder. So any psychological disorders are exclusion criteria from the studies. And actually, if the team is supporting in the psychological level, I don't know exactly, because it's not mentioned, but they're focusing that they are normal people, just anxious of some procedure or treatment, not more than this.
Thank you. Any other question from the audience? I would have one more. What's the typical follow-up time for these studies? Like, so this improvement in the quality of life is only temporary, or it's a long term? I think it's very important for, especially for the survivors.
Thanks for your question. Actually, we took into consideration before and immediately after the intervention, because the follow-up is very heterogeneous. So, for example, we are in painful procedures, so they are comparing, for example, immediately after, just. While for chemotherapy, if the patient gonna start chemotherapy cycles, so it's like pre and after the intervention, and pre the first real session of or dose of chemotherapy, and then during other cycles as well. So we have a lot of results, all the journey of the chemotherapy. So actually, if the I would say if the therapy is for a long term, like chemotherapy, radiotherapy, they are taking more measurements at different time points. But for the short ones, even the results are very state, like pain and anxiety, state and anxiety even. So we focused on pre the intervention immediately and immediately after to have something in common between the studies.